Hi there, Taryn, women's health enthusiast here, and today I want to talk about the idea or concept that a diagnosis can actually cause or at least contribute to body dysmorphia. And so I'm going to use the example of a pelvic organ prolapse because this is perhaps what I most commonly see with women, but this is not limited to the diagnosis of pelvic organ prolapse. I believe that commonly when we are given a diagnosis and when we start to live from a space of feeling broken, feeling not capable or resilient, that can actually cause us to kind of slip into this downward spiral of both how we feel in our bodies and how we perceive our bodies as well. And so let me talk about the example of pelvic organ prolapse. And of course, as health professionals, it's our job to actually help to guide and educate other people who don't perhaps have the same knowledge, understanding, and awareness. So when a woman walks into a clinic and sees her women's physio, gynecologist, for example, and she's told that she has a pelvic organ prolapse and perhaps the stage of the prolapse and then things that she might be able to do to help improve or prevent it from getting worse, and also perhaps some lifestyle choices that may be recommended. That is all fine. I'm not saying that there's any problem with that, but I do feel like we need to be very careful of how we explain to women, and when we are the woman being explained to, that we be very careful of the language that we use and what we actually choose to listen to and what information we can take on board for ourselves and what kind of resonates, but mostly what feels true in your body. Actually, what is that therapist saying that actually lands for you and connects to you? So what I often see is women who've experienced perhaps a traumatic birth, maybe not even a traumatic birth, who are well educated, well informed, and want to go and have a check to see where their pelvic floor is at and how the pelvic organs are sitting and if there is any presence of pelvic organ prolapse. Perhaps she has some symptoms that she wants to check out and she's feeling like, oh, I'm just sensing this heaviness or dragging, this bulging sensation, and I want to know what it is. But often it's actually women who have minimal symptoms and they're going for their regular check. And so in this check, we tend to give a staging or a diagnosis of, yes, there is some movement of the vaginal walls, it's at this stage, or sometimes the kind of language that I've heard are things like you have a collapsed vagina, you have a prolapse, but don't worry about it because that's normal. Yes, you've got incontinence, but that's just something that we experience postnatally. But often it's the diagnosis of you have a pelvic organ prolapse is the one that then women take with them and feel broken and disconnected from their bodies and particularly their vagina. And when they feel that they've been given this diagnosis and then told this means you need to avoid this, this and this, and you can't do this, and I would recommend that you don't do that, and all of those, don't do that, this, avoid that, this is what's wrong with you, starts to come at the woman, and then she starts to feel like, oh gosh, I'm broken, my body has disappointed me, my body has done me a disservice, This is what happens when you have babies, but no one ever told me about this. But then what I see is that how she actually felt in her body before being given this diagnosis, and then how much she then tends to live by that diagnosis according to her health professional's advice could be very different. So her signs and symptoms and how she feels in her body might actually be very minimal. But when we're told you have a prolapse and don't do this and don't do that and avoid this and this means this is going to happen to you and this is how it will progress over your lifetime, then rather than tuning into our body and feeling what feels true for us and what our body is actually saying, okay, this is what it's sensing, this is what it's showing me, this is what feels good in my body and this what doesn't feel good in my body, rather than using our body to be the guide, we use something external to us to be the guide, which then starts to play into this body dysmorphia, this sense that I am broken, I am not capable, my body has done me a disservice. Whatever it might be that we start to then not even tell ourselves, it's just that somebody else has told us something, then the thoughts might be in the head going round and round in circles, or it might actually be this subtle awareness and maybe not even a real, it's almost like a fear of doing the wrong thing through being told you shouldn't be doing this, this and this, or that you have this. And so then that fear that we have starts to play into how we engage in our bodies and how we move in our bodies, rather than having all of the information, having said this is where your body is at this point in time. These are the things that we can do to help improve it, and also simply being present and in your body and with your body will help you to actually get to know your body as it is and understand your body so that it can be the guide for you to then choose how you engage with your body and engage with life. So, I don't feel like I need to give any advice or a what to do from here. It's more a conversation around when we're interacting with health professionals, that we continue to keep our ownership of our own body and don't hand our choices over to a health professional or somebody who is living outside of our own body. Thank you. See ya.